Order! I call Secretary of State Matt Hancock to make a statement. Matt Hancock!
Mr. Speaker, with permission, I'd like to make a statement on coronavirus. And this deadly virus continues to advance across the world. The World Health Organization has confirmed that the number of new cases in Europe is now higher than during the peak in March. Here, the latest ONS figures indicate 6,000 new infections a day, almost double the previous week. As the Chief Medical Officer and the Chief Scientific Advisor said earlier today, we're seeing a rise in cases across all age groups. This pattern is emerging across the entirety of our United Kingdom. And earlier this afternoon, the Prime Minister held discussions with the First Ministers of the devolved administrations and the Deputy First Minister of Northern Ireland to make sure that wherever possible, we are united in our efforts to drive this virus down. We know that the epidemic is currently doubling around every 7 days, and that if we continue on this trajectory, we could see 50,000 cases a day by mid-October. So there can be no doubt that this virus is accelerating, and we must all play our part in stopping the spread. Mr. Speaker, I'd like to update the House on decisions the government has taken so far. The first line of defence is, of course, the social distancing that every single one of us has the responsibility to follow. This includes the basics, hands, face and space, and the rule of 6. And a crucial part of this is people self-isolating if they're at risk of passing on the virus. People who've tested positive and their close contacts must self-isolate. This is the primary way that we together break the chains of transmission. Now, I know that self-isolation can be tough for many people, especially if you're not in a position to work from home. And I don't want anyone having to worry about their finances while they're doing the right thing. So we will introduce a new £500 isolation support payment for people on low incomes who can't work because they've tested positive or are asked to self-isolate by NHS Test and Trace. It will start next Monday. It will apply directly in England, and the UK government will be providing funding through the Barnett formula to the devolved administrations so that similar support can be offered to people in Scotland, Wales and Northern Ireland. Mr. Speaker, just as we're strengthening our support for those who self-isolate, we propose to strengthen the sanctions for those who do not. The vast majority of people who are asked to self-isolate do, but these rules are so important that we must ensure that nobody breaks them. We're therefore proposing a new legal duty to self-isolate, again for people who test positive or who are asked to do so by NHS Test and Trace. This is backed by fines of up to £10,000 for repeat offences and serious breaches. We'll step up enforcement too. NHS Test and Trace will make regular checks on those who are self-isolating, and will crack down on employers who try to prevent staff from following the rules. Over the past few months, self-isolation has been instrumental in breaking the chain and blunting the force of this virus. We know that it works, and with winter ahead, we will support everyone to do what is right to help stop the spread of the virus. The next line of defence is testing and contact tracing. We're doing more testing per head than almost any other major nation. Our daily testing capacity is now at a record high, 253,521, and it continues to grow. And on Thursday, we announced that 2 new Lighthouse labs will be set up in Newcastle and Bracknell, increasing capacity further. But as the House knows, alongside this record expansion, demand has gone up too. And so we need to prioritise the tests for those who need them most, to save lives, protect the most vulnerable, and make sure our health and care services and our schools can operate safely. Today we've published our list of where tests are being prioritised, setting out how we will make sure tests are allocated where they're needed most. First, to support acute clinical care. Second, to support and protect people in care homes. Third, NHS staff, including GPs and pharmacists. Fourth, targeted testing for outbreak management and surveillance studies. Fifth, testing for teaching staff with symptoms so we can keep schools and classes open. And then the general public when they have symptoms, prioritising those in areas of high incidence. And I want to reinforce this important point. The system relies on people coming forward for tests if and only if they have symptoms of coronavirus or have been specifically advised to by a health professional. The testing capacity we have is valuable, and we must, together, prioritise it for the people who need it the most. The next part of our defence is local action. We've been vigilant in monitoring the data and putting in place targeted local measures, so we can come down hard on the virus wherever we see it emerging. In the summer, when the virus was in retreat, we were able to relax some of the measures that we'd put in place. But now, as the virus is spreading once more, we have had to act. On Thursday, I updated the House on the changes we're making in parts of the North East, and on Friday, we introduced new rules for parts of the North West, West Yorkshire, and the Midlands. We've seen some concerning rates of infection in these areas. Liverpool, for instance, Mr. Speaker, now has over 120 cases per 100,000 population, and in Warrington it's about 100. As a result, working with local councils, we're putting in place stronger restrictions to protect local people. In parts of Lancashire, Merseyside, in Warrington and Halton, we're putting in place new measures from tomorrow. As with our strategy overall, our goal is to protect education and employment as much as possible while bearing down on the virus. Residents should not socialise with people outside their own households or support bubble. Hospitality will be restricted to table service only, and operating hours will be restricted, so venues must close between 10 and 5. From tomorrow, in Wolverhampton, Oadby and Wigston, and the whole of Bradford, Kirklees and Calderdale, people should not socialise outside their household or support bubble. We know from experience that local action can work when local communities come together to follow the rules, tackle the virus, and keep themselves safe. And I know how hard this is. We're constantly looking for how we can ensure measures bear down on the virus as much as possible while protecting both lives and livelihoods. And I've heard the concerns about the impact of local action on childcare arrangements. For many, informal childcare arrangements are a lifeline without which they couldn't do their jobs. So today I'm able to announce a new exemption for looking after children under the age of 14 or vulnerable adults where that is necessary for caring purposes. This covers both formal and informal arrangements. It does not allow for playdates or parties, but it does mean that a consistent childcare relationship that is vital for somebody to get to work is allowed. I'd like to thank colleagues from across the House, including the Right Honourable Member for Berwick-upon-Tweed and the Honourable Members for Sunderland Central and North West Durham, for working with us on this important issue. And I hope this change will provide clarity and comfort to many people who are living with these local restrictions. It shows the benefit of cross-party working across the House and listening to concerns as we all do our best to tackle this dreadful disease together. Mr. Speaker, the virus is spreading. We're at a tipping point. I've set out today the measures the government is taking so far. We're working right now on what further measures may be necessary, and the Prime Minister will update the House tomorrow with any more action that we need to take. This is a moment where we once again must come together to tackle this deadly disease, and I commend this statement to the House.
I now call Shadow Secretary of State Jonathan Ashworth.
Speaker, and I welcome advance sight of the Secretary of State's statement, and we particularly welcome the action that he's taken on childcare. There can be no doubt that the presentations that we saw today from the Chief Medical Officer and the Chief Scientific Advisor were stark and deeply concerning. The Secretary of State yesterday described this, and he repeated it today, as a tipping point. I agree we are at a perilous moment. The exponential growth in the virus cannot be ignored. This virus takes lives and it leaves many with long-term debilitating conditions. Every reasonable action must be taken to save lives, minimise harm and keep our children in school. That means a suppression strategy to drive infections down. So will he reject those siren voices who are telling him that the virus has lost potency, or that we should let it rip through the herd while the vulnerable shield. We support the local restrictions that he has had to impose, including in Chorley, Mr. Speaker, and we understand why he's made that decision. Neither he nor I came into politics to place upon individuals a heavy burden of curtailment on our freedoms. And while I, as the official opposition, would always welcome greater parliamentary scrutiny of these restrictions, we will continue to work constructively on a cross-party basis where restrictions are necessary to arrest the spread of this virus. But can I also say to him, ever so politely of course, that the tone of his remarks yesterday rather gave the impression he was blaming people for breaking the rules and allowing the virus to grow. But the reality is that people have done everything they were asked to do. They've missed birthday celebrations, missed weddings, missed funerals. They've sent their children back to school, quite rightly. They've gone back to work. They've done what they were asked to do. In return, ministers were supposed to fix, test, trace and isolate, so we could, in the words of his own government advert, get back to the things we love. Now, before the summer, the government commissioned the Academy of Medical Scientists a scenario plan. They modelled that the R value could rise to 1.7 in September. That's what Imperial currently estimate it to be. And they recommended significantly expanding the capacity of test, trace and isolate programme to cope with increasing demands over the winter. So ministers were warned. But Pillar 1 and Pillar 2 testing capacity did not increase significantly over the summer. In recent weeks, only half of all tests have been received in less than 24 hours. He's repeated his point about asymptomatic people asking for tests. Can he publish the Pillar 2 data which breaks down how many are symptomatic and how many were asymptomatic in asking for those tests? Many parents report going to walk-in centres with their sick children when themselves had no symptoms and being given a test. Was that a national policy, and has that national policy been abandoned? We welcome the recognition that people need financial support to isolate. We've been saying that for months. But as I understand it, it's only available to those low-paid workers who are also on benefits, and not all low-paid workers. So will he consider expanding the eligibility criteria? We've always said that when testing breaks down, tracing breaks down, and the virus gets out of control. And we are now facing a second wave of infection. We don't want, Mr. Speaker, a second wave of ministerial mistakes. All of us want to avoid a further national lockdown. Lockdowns or circuit breaks extract a heavy social and economic price, especially on the poorest and more vulnerable. But controlling the virus and protecting the economy are linked objectives, not in conflict with one another. So I understand he'll tell us we have to anticipate the Prime Minister's statement, but can he confirm that he will use a lockdown if we have one, that he'll use the time wisely, that he'll expand NHS lab capacity, that he'll put public health teams in the lead on contact tracing, that he'll quickly assess the university pilots on saliva testing, that he'll validate PCR pool testing so that those lockdown restrictions are lifted, we can contain the virus for the future. I welcome what he said about prioritising NHS staff, care workers and teachers today, but can he clarify why he has issued guidance to hospital trusts, placing restrictions on the numbers of tests they can carry out? And how will he protect care homes? According to reports today, many care homes have had to wait over 2 weeks for their test results, and data from Public Health England shows that over 200 care homes have had an outbreak of COVID in the last two weeks. And will he ensure that no one is discharged into care homes without a COVID test? Given where the virus is, what support will he, or what is his advice to the shielding community, and what protections is he putting in place for those from Black, Asian and minority ethnic communities, given that we know there's a disproportionate number from those communities in ICU today? None of us want to see another lockdown or circuit break, but we of course understand if one becomes necessary. But test, trace and isolate should have been fixed. That failure has left us vulnerable and exposed. Now we must act with speed to save lives and minimise harm.
Secretary of State.
Thank you very much, Mr. Speaker, and I'm grateful to the honourable gentleman opposite for the constructive approach in which he's approaching these difficult times. He and I agree that the strategy to suppress the virus whilst protecting the economy and education is the right one. And I think that in so doing, it is important to act fast so as not to have to act bigger later. I also agree with him that no one in this House came into office to have to put in place restrictions like these. And he asked about the importance of people following the rules. The truth is, it is vital that all people follow the rules that we put in place. The vast majority have throughout. But critically, enough have not followed them that we need to make them mandatory in many cases rather than relying on people's civic duty. That is the fundamental judgment behind making self-isolation mandatory, as I have announced in the statement today. He asked about testing. Of course, we have that record testing capacity right now. A record 233,000 tests were done out of that capacity on Friday, and that lab capacity will continue to grow. He also asked about the NHS testing capacity, and that will continue to grow also. In fact, I had a meeting with Simon Stevens, the head of NHS England, on that earlier today. He asked about pool testing and using pool testing and saliva testing. These are just two of the many new testing capabilities that we're bringing to bear. And he also asked to ensure that there would be no admissions to social care, to care homes, without a test. That is our policy, not just no discharges from hospital, but no admission from anywhere into care homes without a test, and that was reiterated in the social care winter plan that we set out on Friday. But I suppose at the heart of the response of the official opposition and my response to him is that we are united in wanting to tackle this virus and in sending the message to everyone across this country that it is critical to follow the rules and for everybody to play their part in making sure that we can suppress this virus whilst protecting as much as possible the things that we love.
Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. I support the measures outlined by the Health Secretary, which are regretfully both necessary and proportionate. Last week on World Patient Safety Day, the WHO announced a charter for health worker protection, which asks all WHO member states to commit not just to adequate supplies of PPE and mental health support, but also to make sure there is zero tolerance of violence against health workers. Will he commit the government to sign up to this charter so that as we go into a second wave, all our brave frontline workers know that this government and this House stands foursquare behind them?
Yes, I will happily sign up to the proposals that my right honourable friend has set out. As the House well knows, my right honourable friend's long-standing and international work on patient safety is very, very impressive. And we must make sure that in these difficult times we protect our care workers and our frontline staff, including, if I may say so, the staff at the testing centres, and make sure that we reiterate once again our commitment to patient safety.
Coming back, SNP spokesperson Dr Philippa Whitford.
Thank you very much, Mr. Speaker. As the Chief Medical and Chief Scientific Officer said this morning, the UK is in danger of losing control, as we have seen in many countries in Europe. And as the Secretary of State has said, we could be facing 50,000 new cases a day by mid-October, which would lead to about 200 deaths a day by mid-November. And no one should be in any mistake to think that the virus has changed and it will not kill people if we get back to where we were in April. I agree utterly with the Secretary of State that we need to take action now, and that action is personal. Every single person has responsibility to stick to the rules, to wear a face covering, to wash their hands, and to keep their distance. And I would remind members in this House, because I've been watching it from outside, that is not always what is on show in this chamber. And we all have a responsibility to set an example. And that responsibility extends to self-isolating. Whether we have symptoms, whether we are proven, whether we are a contact, or whether we have returned from a high-risk country, If we are meant to be isolating, we need to do it. And I really welcome that the government is finally putting in place this financial support for people on low incomes who might be tempted not to isolate because they simply don't have any other opportunities to feed their family. However, it is critical that we have a fast and responsive test and trace system. And therefore, I have a couple of questions for the Secretary of State. In recent weeks, he has talked about aiming to have 500,000 tests a day by the end of October. So with the surge we are facing, does he envisage being able to accelerate that and bring it forward? And secondly, on the 8th and 15th of September, he committed to me that he would be increasing funding to expand NHS testing. But as we heard from the Shadow Secretary, NHS trusts in England have been told that funding is capped and they are not to expand COVID testing. Surely this is resource that we want to use and make available.
Thank you very much, Mr. Speaker. Well, I wholeheartedly agree with the Honourable Lady's comments about the need for action across the UK, and we've seen in Scotland, as in England and Wales and Northern Ireland, that the number of cases sadly has risen sharply. And I welcome her physically back to the chamber in demonstrating this unity of purpose across the four nations of the UK. If we can bring forward the goal of 500,000 tests per day from the end of October, then of course we will, and we're pushing that as hard as we can. We are on track to meet that commitment. As she says, that is across the UK, so that does include the tests that are done by the Scottish NHS, and I know that there have been conversations between the NHS in Scotland and in England to work on making that happen. And as for NHS testing, yes, we are expanding that, including the funding, and in the funding letter that went out to the NHS for the second half of the financial year, so the covering winter, that includes the commitment to support financially the testing that's done in the NHS in England.
We now come to Chris Cradley.
Mr. Speaker, and can I welcome the measures my right honourable friends announced today. He seems to be getting the balance absolutely right, and I praise him for the job he's doing. But we do have to remember, Mr. Speaker, that there are huge regional variations in the impact of the virus at the moment. Many parts of the country have much lower infection rates. Given the huge consequences of this virus for people in our communities on their mental health, particularly the younger generation who are paying a very heavy price, can I say to him that given those regional variations and in the full knowledge of all the pressures that he is facing, I do not believe the case for further national measures has yet been made?
Well, thank you very much, Mr. Speaker. There is an important balance between the measures that we need to take across the country as a whole and then the further and stronger measures in local areas. And my right honourable friend will have seen over the past especially over the past week, that we have expanded some of those local interventions to cover bigger geographies. But he's absolutely right that there are some parts of the country where the number of cases is still thankfully very low. And so the balance between what we do nationally and what we do locally is as important as the balance in terms of what we do overall.
Sarah Wilson.
Mr. Speaker, I'm sure the Secretary of State will agree with me that one of the greatest tragedies of the first wave was the loss of life and the impact on our social care sector of this dreadful virus. And we must learn the lessons from that as we head into a second wave. So whilst he has emphasised a prioritisation of testing in care homes, both in the media and his statement today, could he explain why a number of care homes are still reporting a 2-week delay in receiving test results? And will he clarify whether his prioritisation also includes staff providing care in people's residential homes?
The care home testing is incredibly important. We have brought down some of those response times, and I'm glad to report to the House that since last week, when we debated and discussed the very sharp rise in demand, including amongst asymptomatic people, that demand has come down somewhat, and the pressures are a little lower. That doesn't, on the testing system as a whole, that doesn't mean that we don't want to increase capacity further. Of course we do. It is very important that we have tests available for all vulnerable people, whether they live at home or in a care home.
We now come to chair of the Select Committee on Science, Greg Clark.
Thank you very much indeed, Mr. Speaker. Perhaps I could ask the Secretary of State that the scientific evidence is that COVID is detectable by test within 7 days of someone being infected. So why shouldn't people who've been made to self-isolate be tested 7 days after a possible infection and be released if they test negative?
The incubation period before which the virus can present itself is still estimated to require a 14-day self-isolation. If we can bring that figure down, I'd be the first to be pleased to do so. And as we took to 10 days, the period in which somebody who's tested positive must self-isolate, and this is a point that is critical, on which we must rely on the scientific evidence. If he has further scientific evidence, I'd be very happy to look at it.
Very Khalifa.
Thank you, Mr. Speaker. Can I ask the Secretary of State if he thinks a £10,000 fine will act as a disincentive to poorer people getting a test?
Well, we've put in place the extra £500, the £500 in addition to other income that people are getting for people on low incomes, in order to support them to do that self-isolation. I think that people want to know whether they've got the virus, if they've got symptoms, and the result of having a positive test is that you get the money, the extra £500 if you're on low incomes, and of course you have to self-isolate. So I'm confident that people will come forward, of course, do the right thing for society, but also the right thing for them to find out what the cause of their illness is if they have symptoms.
Thank you, Mr. Speaker, and can I thank the Secretary of State for the extra £2.5 million for the Worcestershire Acute NHS Trust, and also for the extra money for the social care system in Worcestershire. But can I just clarify what the advice is these days for people who would normally perhaps have fetched up at A&E? Is it to call 111 in every instance now?
Yes, we're moving to a system where the advice is to call 111 first and then go to A&E. Now, of course, or call 999 if you need an ambulance, if it's an emergency. And that system will both help people to be triaged to the right treatment, which may be to see a GP or go to an urgent treatment centre, but of course may be to go to A&E. But it also helps the emergency department to know that people are coming. It's the combination of the two that is critical. We're rolling this out over the country over the next the forthcoming couple of months, and we aim to have it in place right across the country by the 1st of December.
John Cryer.
Thank you, Mr. Speaker. Despite what the Secretary of State has said today, we're still hearing myriad stories of people being our constituents still unable to get to be tested. The worst story I've heard is a constituent who was told to travel 600 miles to Aberdeen to get a test. Now, why is that the case when we're constantly told by ministers that there's no problem?
Nobody's addressed the problems and the challenges that we've got in the testing system more than me. What we need to do is resolve those problems, as we have, in the very large part, resolved the problem of people being sent long distances. I'd love to know the example that he cites, because I am told that problem in the system was fixed last week, and if there's a more recent example, then I want to know about it.
Simon Fell.
Thank you, Mr. Speaker. I welcome my right honourable friend's commitment to expanding testing. It's clearly key to identifying the virus and stopping the spread of it. I'd point him to an article in the Times today about private businesses expanding testing capacity. BAE in my constituency is testing almost 6,000 employees on a weekly basis. They're keen to expand that into the community. I know my right honourable friend has already started engaging on this issue, but I'd urge him to do everything he can to cut through any red tape there, to expand this as quickly as possible and use every tool at our disposal.
We support businesses and others who want to get tests outside of the NHS test and trace system. And we published a paper last week on how they can go about doing that, and we encourage businesses to do that for their employees. The critical thing is that if people test positive, that data must flow, and by law, because it's by law, that must flow to Public Health England, so that we can then do the contact tracing that's necessary, and so that we can enforce the isolation that's going to be mandatory from next Monday. But we strongly support this sort of action, whether it's from employers or indeed Cambridge University, who are proposing to do this for their students.
Johnson.
Thank you, Mr. Speaker. Liverpool incidence rates have increased very quickly and are now on the precipice of a local lockdown. There's been an increase of 247 cases on the previous week, and the latest weekly rate in Liverpool is now 120 per 100,000, as already mentioned by the Secretary of State. What additional resources does the Secretary of State plan to provide to Liverpool and other local authorities to assist them with dealing with further localised outbreaks?
The Honourable Lady Russ asks a very important question. We're putting more testing into Liverpool, even notwithstanding the challenges in testing capacity, because it's exactly the sort of place where we need to put that testing. And of course, we're bringing in the support for everybody who's on low incomes, who has to self-isolate, the £500, whether you've tested positive yourself or whether you're a contact of somebody who's tested positive, who's been contacted through NHS Test and Trace. But I support the Honourable Lady in her work to explain to, as the local representative to her constituents in Liverpool Riverside, about how important it is to follow these rules.
Sam Clark.
Thank you, Mr. Speaker. The whole country will recognise the unenviable choices facing the government at this time. Whatever further measures are in contemplation for the days ahead, can I issue a plea for proportionality? And would he agree with me that human beings in a free society must have a right to some social contact as they go about their daily lives, even at this difficult time?
Yeah. I agree with that 100%. For those who live alone, or lived alone, during lockdown, we put in place the support bubbles for single households precisely for this reason. I remember having a Zoom with a whole load of people, and somebody on it said, I haven't seen anybody for 4 months in person. And I thought, this is, that can't be good, it can't be right. So we have put in place support bubbles for single households for that purpose. And of course we bear these impacts in mind when we take the decisions that we do.
Let's head to the member for Huddersfield, Barry Sherman. Barry Sherman.
Mr. Speaker, I'm sure that the Secretary of State will agree with me that we in Kirklees and West Yorkshire are working very hard as a team to meet the crisis that we have. And of course, that these uncertain times with tens of thousands of students now moving across our country, could you bear in mind, though, that our system relies on fit and healthy NHS staff because the crisis that we're in is getting worse? And if we get a flu virus, a virulent flu virus this winter coming soon, and it knocks out a large percentage of our NHS staff, we are going to be in serious trouble. And a very large percentage, a significant percentage of our NHS are refusing to get a flu jab. What can we do about that?
Yes, Mr. Speaker, the Honourable Gentleman and I have occasionally tangled across these dispatch boxes, but I wholeheartedly support what he said and agree with him entirely. It is policy that everybody in the NHS should get a flu jab. And that flu programme within the NHS has started to roll out already and will very shortly roll out more broadly. And I can, whilst this year that is not mandated, I can see no good reason why somebody in the NHS, unless they have a very specific clinical condition, does not get a flu jab. We look to all NHS staff to provide that leadership in their communities by getting the flu jab. It's free for everybody who works in health and social care, and they should get it.
Michelle Brook.
Thank you, Mr. Speaker. Mr. Speaker, it's brought to my attention by parents this weekend that some of the Leeds City Council schools in my constituency are telling parents that if their child has an upset stomach or a general malaise, that they need to go home, isolate, and not come back to school until they've had a negative test. Does my right honourable friend agree with me that this is not the advice of NHS England? Does he agree with me that this puts unwanted pressure on the test and trace system? And does he agree with me that Leeds City Council need to get a grip of this immediately?
I'm afraid I do agree with that, Mr. Speaker. All councils, including Leeds City Council, should make clear that if students have coronavirus symptoms, and we all know what they are, it's a new continuous cough, it's a temperature or a loss of taste and smell. If people have coronavirus symptoms, then they should come forward for a test. But if they have symptoms of another illness, then and not of coronavirus symptoms, then they should not come forward for a test. We've set out this very clearly today in the prioritisation document that we've published once again, and I hope that everybody will follow it.
To Ealing North with James Murray. James Murray.
Mr. Speaker, schools that become aware of a COVID-19 case have been encouraged to take swift action and contact the dedicated advice service introduced by Public Health England. However, several primary school heads in my constituency have reported this service appears overwhelmed, with significant delays in Public Health England getting back to schools with their advice. Can the Secretary of State tell me what the average waiting time is between a school contacting Public Health England and school receiving the advice they need?
I don't have those figures, but I would be very happy to look into the specific cases, because obviously the speed of turnaround in the instance he describes is very important.
Thank you, Mr. Speaker. My right honourable friend and his scientific advisers are absolutely right that the virus is not getting any weaker, but doctors, including many in my constituency of South Cambridgeshire, have made great progress in the treatment of coronavirus, and also social distancing means that viral loads are less for many people, making the cases less severe. Can my right honourable friend tell me what estimate is made of the impact of these developments on the fatality rates of those who do get affected?
Yes, of course. My honourable friend represents one of the finest hospitals, not just in the country, but in the world. And the clinicians who work at Addenbrooke's and right across the country have improved the treatment of coronavirus. We know because of dexamethasone, that has reduced the death rate. We know that because of earlier oxygenation and later intubation, that has reduced the death rate. And there's also progress with remdesivir, Mr. Speaker. Nevertheless, whilst this has reduced the mortality from those going into hospital, this virus remains deadly, and therefore we unfortunately do have to take measures to stop its spread, not least because we can either take measures now or we'll end up with a much bigger problem and still having to take measures later.
Dr. Ruperhart.
Mr. Speaker, top-rated medical research has continuously linked vitamin D levels with COVID incidents. So in Norway, where they have high amounts of it, cases are very rare, whereas here, most Brits are deficient. It's rarely found in food. And the main source, sunlight, is about to disappear with a possible winter NHS crisis on the way. So could he please follow the science? There's no vaccine in sight. And look to prescribing supplements on the NHS, or at least doing a public information campaign, because people need something positive now the nights are drawing in.
Mr. Speaker, vitamin D is one of the many things that we've looked into to see whether it reduces the incidence or the impact of coronavirus, and I've seen reports that it does. So we therefore put it into a trial, and unfortunately the results were that it doesn't appear to have any impact. So that is the latest clinical advice, which of course is always kept under review.
Graham Brady.
Mr. Speaker, does my right honourable friend agree with me that balancing the measures to tackle COVID with the other health consequences, such as cancer patients going undiagnosed or not treated in time, and the economic and social consequences, is a political judgment? And does he further agree with me that political judgments are improved by debate and scrutiny?
Yes, I do. And I do come to this dispatch box as often as possible. I'm very sorry that I wasn't able to come on Friday for Friday's decision, but the House wasn't sitting. I agree with my right honourable friend that essentially the more scrutiny, the better is my attitude. I'm very happy to continue to work with him and you, Mr. Speaker, to ensure that that scrutiny can be done at the speed that sometimes these decisions have to be made. I would finally, on the substantive point that he raises, of course, minimising the impact on the economy and education is critical. There are impacts on the NHS of COVID cases going up, not just, of course, the need to try to minimise the negative impact of on restricting other treatments like cancer that happened in the first peak, but also the problem that high levels of COVID cases means that it's harder for the NHS to operate. So within the NHS, a higher number of cases itself has an impact on the care available for all of the other conditions that we need to treat. But I look forward to working with you to make sure we have continued scrutiny.
So do I, if that happens. Can I now go to Stella Creasy in Walthamstow? Stella Creasy.
Thank you, Mr. Speaker, and I'm delighted to have just heard the Secretary of State's previous answer, because in a former lifetime, he and I both served on the Public Accounts Committee. So I know he will understand that every taxpayer living in a community facing a lockdown or unable to get a test deserves a straight answer as to whether his department has imposed a financial penalty or withheld payment for the many voided tests undertaken by Randox. Will he give an answer to that question today?
Mr. Speaker, Randox deliver a very significant number of tests every single day, a growing number. In fact, they're currently outperforming the allocation that we've asked them to deliver, and I pay tribute to every single person who works at Randox for the work that they have done and the part that they have played in keeping people safe. Because everybody who gets a Randox test result, just like every other test result, has more information with which they can keep themselves safe, and we have more information with which we can try to keep the whole of society safe.
Andrew Percy.
Speaker, can I thank the Secretary of State for his department's allocation to Scunthorpe Hospital last week, and also wish him well with the ongoing work for some extra funding for Gould Hospital. On the issue of tests for schools, the feedback I've had from schools in my constituency so far has been very positive about the 10 tests that they've been issued with. Can he continue to seek to grow that number and look particularly at a lot of the rural schools where getting access to a test is particularly difficult due to transport issues?
Yes, giving 10 tests to all schools across the country has proved, the feedback I've had is that that's proved very popular. I'm very glad to hear that's true in his part of the world as well. Of course, we'll continue that with the right level of tests being sent out to the right types of schools in the right places. And I'll make sure that we take into account rurality as one of those factors.
Tonya Antoniazzi in the Gower. Tonya.
Thank you, Mr. Speaker. On Friday afternoon, the Department for Work and Pensions informed job centre staff that from today they have to reintroduce face-to-face 10-minute work search interviews with customers. So, Secretary of State, in light of the rising number of cases and with everyone meant to be playing their part, is this really a sensible approach to be taken?
One of the good things about where we are now compared to where we were in March is that in many, many areas we're better prepared. We're better prepared in the NHS, we're better prepared in social care with the winter plan we put out last week, and many employers and services like job centres have been able to develop COVID-secure approaches, which means that they can get on with things that they need to do. So the specifics of the question, of course, are for my right honourable friend, the Work and Pensions Secretary, but the principle of how we've managed as a society to do more things whilst keeping ourselves so COVID secure is one that we've been able, thankfully, to develop over the last 6 months.
Thank you, Mr. Speaker. I very much welcome the Health Secretary's approach to not only save lives, but also protect livelihoods. I really acknowledge and welcome his announcement on the new exemption for childcare. Can he just confirm what those new arrangements are, and confirm that grandparents and others in my Colne Valley constituency, part of Kirklees, which goes back into local restrictions tomorrow, will be part of that exemption?
Yes, I can confirm that. The exemption means that, for instance, if grandparents look after children in order to provide childcare, where that is a continuous childcare relationship, that's the legal definition, then that will be exempt in the same way that paid for childcare will be exempt. This therefore doesn't allow for people to have children staying with others and as I said in my statement, parties and play dates. It allows for where a family member or other undertakes unpaid childcare that is akin to paid childcare, then they can be exempted. And I know how much many people rely on this in order to be able to get to work, and I'm really glad we've been able to make this progress.
Those of us who represent areas which are going to face additional restrictions as of tomorrow are happy to reinforce the messages, but we need his help, don't we, Mr. Speaker? The difference between the instruction of households that they must not go and visit each other as opposed to they should not go to the pub together is one of the ambiguities that my honourable friend, the member for Leicester South, has highlighted right from the start of this crisis. It is an ambiguity that is exploited by the virus, but it is also exploited by, sadly, a small but important minority of people in this country. Will he clear up these ambiguities and improve the chances that everybody will comply with these necessary new restrictions?
The message that he should be putting out, and that I will set out, is that where we say that people shouldn't socialise outside their household, that is the approach that people should take, ensuring that he makes a detailed point underneath that, but the top line message to all of his constituents is no, they shouldn't be socialising with people outside of their household.
Speaker, I've been contacted by a large number of constituents over the weekend concerned about the fact that there is still a large minority of people in retail setting that aren't wearing face coverings. Now, most retailers are making sure that they follow the rules and they enforce it, but what support can his department give across government and a local level to ensure that when it comes to the small minority, we can enforce these rules and ensure, as he said quite rightly, that we're all in this together and we stop the spread together?
Mr. Speaker, I agree with my honourable friend that more enforcement is sadly necessary to ensure that these rules are followed across the board. Because if people follow the rules across the board, it'll be easier to get a grip on the virus, and the overall impact on the economy, on education, for instance, will be lower. And so that's the approach that we're taking, both in the example that he cites and more broadly.
Thank you, Mr. Speaker. The Secretary spoke about a four nation approach, but there's a reality. There hasn't been a Cobra meeting since the 10th of May. It's taken the First Minister of Scotland to push for this to actually get a UK-wide Cobra meeting set up. So that undermines the four nation approach. Does he agree for a four-nation partnership? Then that also means Scotland needs the powers and the financial levers to be able to implement its own local decisions, such as targeted furlough support for, say, the hospitality and aviation industry, and perhaps health areas under local lockdown.
I would urge the honourable gentleman to take the lead from the SNP spokesman on the front bench. These are very serious times, and since the Prime Minister had a conversation with the First Ministers of all the devolved administrations this morning, as I set out, and I have regular and frequent engagement with all of the other health ministers. In fact, I was having a text exchange with my Scottish opposite number just before coming into this chamber. I think that the most important thing is that we take as united an approach as possible, and that is the approach that the Scottish Government is taking, and we're working closely with them.
Thank you, Mr. Speaker. I'd like to also welcome the statement that the Secretary of State has brought to the House today, and particularly the emphasis he places on fighting this common enemy as one united front. Could I ask my right honourable friend what assurances he can give the House that our care homes will be protected with lessons learned from the first wave of Covid-19?
Yes, I entirely agree with my honourable friend. Right across the board, it's critical that we're constantly learning about what both went well and what didn't go well. And the social care winter plan that was published last week has been developed with the sector. I visited a care home on Friday and heard from them about what they've learned, about how policy has developed to make sure that we protect people in care homes as much as possible.
Heading to Hampstead to Tulip Sadiq. Tulip.
Thank you, Mr. Speaker. Last year, I was faced with every parent's nightmare as I rushed my small baby to the children's A&E at the Royal Free Hospital in my constituency because he wasn't breathing. The doctors and nurses saved his life. The same children's A&E will now be closed temporarily from next month because of the pressure that COVID-19 will put on the NHS over winter. I would like to ask the Secretary of State to give me a cast iron guarantee that our local NHS will be given all the resources it needs so that this closure is strictly temporary and the children's A&E service can be restored as soon as possible.
Well, of course, I'd be very happy to work with my honourable friend, with the honourable lady, on this question. We do have to make sure that our hospitals are COVID secure, and I'd be very happy to meet her and discuss the specifics of the Royal Free.
Shredwoodley.
The trouble with authoritarianism is it is profoundly inimical to civil liberties. It is also increasingly incompetent. It relies on acquiescence, and acquiescence for lockdowns, particularly national ones, is draining away. For instance, if you tell a student not to go to a pub, they'll simply congregate in rooms, even worse. If the Secretary of State doesn't listen to me, will he at least listen to Professor Mark Woodhouse, Professor of Infectious Diseases, writing in the Sunday Telegraph, where he writes, "It is profoundly disappointing that 6 months into this lockdown, having rejected every alternative proposal, we keep coming back to lockdowns." And he suggests, and I'm trying to be constructive, he suggests that we rely on encouraging people to look after themselves, protect the vulnerable, and take responsibility for their own lives. That is the Conservative way.
Secretary of State.
Mr. Speaker, as a Conservative, I believe in as much freedom as possible, consistent with not harming others. And one of the sad things about this virus is because of asymptomatic transmission, if you get ill and if you put yourself at risk of catching coronavirus, you're not only putting yourself at risk, you're putting others at risk as well. And so that is the Conservative principle behind protecting the health of the nation in the face of this pandemic.
Heading up to Rochdale to visit Tony Lloyd. Tony Lloyd.
Thank you, Mr. Speaker. The Secretary of State will accept that a near 1 week turnaround for tests for people working in our care homes is not looking after our elderly. But can he be precise? When will we get that 24-hour turnaround that we've got to have if we're to keep the elderly safe in those homes?
Mr. Speaker, we have protected the number of tests in care homes. The challenge is that when the system is running hot and the number of tests going through is very close to capacity, that can have an impact on turnaround times, and we saw that in the last couple of weeks. Thankfully, those turnaround times are coming down again, as well as us managing to protect the over 100,000 tests a day that go to social care. Because whilst some may call for other areas to be prioritised, for instance the tests of children, I think the most important thing is that we protect those who are most vulnerable to this virus, and the most vulnerable live in our care homes.
Thank you, Mr. Speaker. I know the Secretary of State is very keen to get more tests. SureScreen in my constituency have developed an antigen test which is ready in 15 minutes. They will be able to ramp up their production to 1 million by November, rising up to 2 million a week. Would my right honourable friend please look at their tests and make use of this expertise? But also, could I remind the Secretary of State, I think he'll be going into a Cobra meeting tomorrow. Could he explain to the Prime Minister that we actually live in a democracy, not a dictatorship, and we would like a debate in this House on...
Yes, there absolutely will be a debate in this House on the measures in that we have to use. We do have to move very fast, and I'm very happy to talk to my honourable friend about Shaw Street. Shaw Street in her constituency.
Wayne David.
In South Wales, Caerphilly and Rhondda and Taff are in local lockdown, and people in these boroughs cannot leave the borough to go on holiday. These two areas will be joined by 4 other areas tomorrow evening. The Welsh Government has said that these would-be holidaymakers should have a full refund if they're prevented from going on holiday. Will the Secretary of State say emphatically that these people must have a full refund of the cost of their holidays as a policy of central government?
Secretary of State. I'm very happy to work with the honourable gentleman and others to make sure that people get the fair treatment that they deserve.
We now come to Sir Bernard.
Thank you, Mr. Speaker. At a time when we know that we haven't yet got the world-beating tracking and trace system and we haven't got enough tests because of logistical problems, why is the government excluding senior military commanders from the key decision-making that would enable them to bring to bear their logistical capabilities?
On the contrary, Mr. Speaker, we have military support who've been absolutely brilliant in expanding the testing system, test and trace, and indeed they're engaged in the development of our vaccine rollout plans. And I think that the work that's been done by senior military personnel is absolutely first rate.